Okay, we're back and we're going to continue our discussion on coding cardiovascular disease, starting with more on AMIs. I think here's where we left off. Type 2 myocardial infarctions, in other words, myocardial infarctions due to demand ischemia or secondary to ischemic imbalance, are assigned to codes from code subcategories I21.A1, myocardial infarction type 2 with code for the underlying cause coded first. Do not assign a code I24.8 other forms of acute heart disease for demand ischemia. If we have a type 2 AMI where the underlying cause is dependent on the circumstances of admission, if a type 2 AMI is coded as a non-STEMI or a STEMI, only assign code I21.A1. Codes I21.01 through I21.4 are only assigned for type 1 AMIs. And again, acute myocardial infarctions of type 3, 4A, 4B, 4C, and 5 are coded to code category I21.A9, other myocardial infarction types. The code also and code first notes should be followed related to the complications and for coding of post-procedural myocardial infarctions during or following cardiac surgery. We use a lot of different tools to diagnose acute myocardial infarctions. This includes the patient's history, physical exam, an EKG, and measurements of serum levels of cardiac enzymes such as troponins or CK-MBs. Treatment may involve intravenous tissue, plasminogen activator, or TPA medications. Chronic ischemic heart disease, falling in code category I25, is also known as atherosclerotic heart disease, arteriosclerotic heart disease, and coronary artery disease, all fundamentally the same thing. General myocardial atrophy and scarring from progressive narrowing of the coronary arteries. We may have episodes of sudden severe coronary insufficiency, and this may evolve into either angina or a STEMI. Atherosclerosis is when the arteries get narrow from the constant buildup of plaque from inside the arterial walls of the vessels. Enlargement of these lesions narrows the lumen, and this decreases the volume of blood. Large arteries, the aorta and the main branches, are primarily affected. This produces chest pain, shortness of breath, and elevated blood pressure. Atherosclerosis is a major cause of ischemia in the heart brain extremities. This can cause stroke, heart failure, and other problems. Subcategories or I25 identify the specific coronary vessel involved and whether it's native, in other words, born with, or a bypassed vessel, and the presence or absence of angina. There are other forms of chronic ischemic heart disease that have codes available. These include old myocardial infarction, ischemic cardiomyopathy, chronic total occlusion coronary artery, coronary atherosclerosis due to lipid-rich plaque, coronary atherosclerosis due to calcified coronary lesion, and others. The key is to review the documentation carefully and make sure that you're coding this correctly under subcategory I25. Heart failure is basically meaning that the heart isn't able to pump blood well, and it can be caused by many different heart problems. It can be systolic, diastolic, and involve cardiomyopathy, hypertension, and heart valve disease. Heart failure may involve the left side, the right side, or both. Usually, heart failure affects the left side first. And in this case, it affects the pressure in the lungs, kidney function, and blood is not circulating properly. And again, heart failure falls into code category I-50. Heart failure causes the blood to flow in and out of the heart at a slower rate. This can cause blood in the veins to collect before returning to the heart, right? So you see the swelling in the extremities and so on. Please review figure 12.2 in your text for more information. When we talk about left-sided heart failure, we're talking about two types. Systolic heart failure, where the left ventricle, the part of the heart that pumps blood, loses its ability to contract normally, and the heart cannot pump well enough to force blood into circulation. We can also have diastolic failure. What this means is the left ventricle loses its ability to relax normally because the muscle is stiff. So then the heart cannot properly fill with blood during the resting period between each beat. Systolic and diastolic heart failure may be one of two types. And this is something you may want to look at that material that I've posted on Canvas. It can either be acute, chronic, or acute on chronic. Blood, of course, returns to the heart through veins on the right, through the right atrium and into the right ventricle. The right ventricle then pumps the blood into the lungs to be replenished with oxygen. Right-sided heart failure is usually the result of left-sided heart failure. When the right side loses its pumping ability, blood backs up in the body's veins, causing swelling in the legs and ankles. There are diagnostic tests we can use for heart failure. These include such things as chest x-rays, echocardiograms to measure the ejection fraction being the measurement of the heart at rest versus when it's contracting, laboratory tests. Some ways we treat it include ACE inhibitors, diuretics, low sodium diets, modification of activities, and lifestyle changes. And of course, we can have cardiac arrhythmias. These are conduction disorders. These can be disturbances. And you see terms like atrial fibrillation, atrial flutter, ventricular fibrillation, sick sinus syndrome. And these are the terms that you would use in the alphabetic index to find the correct codes. Wolff-Parkinson syndrome is a conduction disorder in the electrical impulses that regulate the heartbeats. Atrioventricular heart blocks can be described as first degree. These are usually associated with congenital defects such as ASD or valvular disease. Second degree, associated with acute myocardial infarction, or third degree, associated with ischemic heart disease, infarction, or other reasons. Finally, we have cardiac arrest. This is the sudden stopping of the heart's pumping function that causes arterial pressure to cease and produce either ventricular fibrillation or a standstill. And there are three codes for this. These include I-46.2, cardiac arrest due to underlying cardiac condition, I-46.8, cardiac arrest due to other underlying condition, or I-46.9, cardiac arrest cause unspecified. And important to read the code first notes to code the underlying condition. There is an excludes one note that's very important in the tabular that cardiogenic shock R57.0 is not assigned with the code from I-46. And that's all I have for you. Come back and we'll be finishing our last lecture on coding diseases of the cardiovascular system. Bye now.